This lecture will teach you everything you need to know to take care of your lasered skin. You can't watch this too early. You should definitely watch it a couple of months before your laser, a couple of weeks before your pre-op appointment, and then right before your surgery. It's also helpful if you need to watch it once you've gone home. Ablative lasers are used to help improve the skin's texture and appearance. It can also be used to help reduce wrinkles, and it leaves your skin looking healthier and more attractive. I use the Cyton Erbium Jewel laser, and this is a laser that's attracted to the water in your skin. I am all about using analogies to teach you what we're doing. So lawn care is a great analogy when it comes to lasering your skin. First, we're going to mow it, and this is the resurfacing part. The deeper we go, the shorter the grass is going to be. Then we aerate it. You know those plugs of dirt that come out of your yard? Well, that's the profractional part, and we can make vaporized channels in your skin that go pretty deep, but because they are in a dot matrix pattern, you heal more quickly. Then we're going to add some grass seed so that you can grow a more beautiful lawn. These are the stem cells that come from your nanofat. Then we're going to add some fertilizer to help everything grow, and this is the platelet-rich plasma that we get from a blood draw at the beginning of surgery. You want to have your skin well prepared for the laser because this will improve your results, decrease the risk of hyperpigmentation or brown spots as a reaction to the irritation from the laser, and will also help you to maintain your results. There are 3 components to your skin prep. One is a retinoid, and with this one, you want to start it as early as possible. The second is a pigment reducer. The most common that we'll use contains hydroquinone, and you should start this 4 to 6 weeks prior. Also, it's not required, but a nice addition is a hyaluronic acid, which provides hydration during this process. So first, let's talk about retinoids. I'm sure I tried to convince you how great they are when you came in for your appointment. If you haven't started one, it's important to do so as early as possible. Now, retinoids are always a product that you're going to use at night, not during the day. You're going to start slow with a weaker version, and you're going to gradually increase in frequency. So when you start, you might be using it a couple of times a week, and after a few weeks, I want you to try to be using it daily, or nightly to be more exact. Over the next months to years, as you're replacing your empty bottles, think about whether it's time to increase in strength. Hydroquinone is in products that help decrease the skin's ability to make brown pigment. Your body makes these brown spots in reaction to irritation, and there's nothing more irritating than having a laser. You should start this 4 to 6 weeks prior to your procedure. You can use this once or twice a day, and we have multiple products to choose from. You can use Obagi Clear, Obagi Blender, or Obagi C Clarifying Serum. There's also a botanical option called IS Clinical Brightening Complex if you'd like to avoid hydroquinone. Now, hyaluronic acid is not required, but it is a nice addition. Hyaluronic acids hold water in your skin, and for every molecule of HA, it can hold 1,800 times its weight of water. Why is water important? Well, the erbium laser that we're using is attracted to water. So the more water that's in your skin, the better your treatment is going to be. We have a couple of really nice products. One is Epicutis Lipid Serum, and what's special about this one is it also contains an anti-inflammatory that can help you continue to heal from your laser. The other is Revision Hydrating Serum. This is a little lower price point and is also wonderful at holding water in your skin. Viral prophylaxis is important. Some of us have had cold sores before, but many of us do carry the herpes virus without knowing it. Laser irritation can cause an outbreak, and we certainly don't want that to happen when you're healing from your laser. You'll receive a prescription for Valtrex, or the generic is Valcyclovir, and you'll start one of these tablets the night prior to your surgery. If cold sores are not uncommon for you, you'll want to start sooner, at least 2 or more days prior to your laser. On the day of surgery, you want to come in with clean skin, so you'll take a shower before you come in. Don't apply any makeup, sunscreen, or moisturizer. If you are using one of the hyaluronics, it's fine to apply that. When it comes to healing from the laser, which is everybody's least exciting part of this procedure, we have 2 different options. The first is an occlusive mask technique, and you will heal light years faster, have less discomfort, and overall this is much easier for patients. Now, the old school method is the open technique, where you'll be using Aquaphor and cold compresses on your skin. There's slower healing with this procedure. It is more uncomfortable, and you really have to be on it. You can't slack off and let your skin dry. The occlusive mask techniques includes a deep layer of specialized silicone, an absorbent middle layer, and a protective silicone mask outer layer. This holds all those goodies right next to your skin and prevents your skin from drying out. Now, I know this picture may alarm you, but just wait, brace yourself. We're going to have some pretty gross ones to see next. I wasn't kidding. This looks a little bit scary right away. So your skin is going to be very raw and bloody, and I apply the growth factors that came from your blood, which makes it even bloodier, and then a layer of oil that comes from your fat transfer that has the stem cells in it called nanofat. The next layer is called Cylon TSR, and TSR stands for temporary skin replacement. This is a very specialized, super thin layer of silicone that seems a lot like saran wrap. It will slide all over your face, and we want to try to prevent that. If it's getting in your eyes or up in your nostrils, you can definitely just take a Q-tip and move it out of the way. The next layer is going to be something that provides some absorbency, because there is going to be a lot of fluid created during the healing process. This absorbent middle layer may be white or beige colored, and on the day you remove everything to take your shower, if there's anything stuck to you, just leave it on, get in the shower, let it get soaking wet, and it should release. The next layer, which is the outer layer, is a thicker silicone mask with elastic straps. I will customize the nose holes and the mouth holes to try to give you as much coverage as possible, but still allow you to breathe. We're going to try to leave this whole contraption on for 3 to 4 days. You do need to be careful where it covers your earlobe, because you may be numb there, and we don't want excessive pressure there. We also don't need to do anything about your facelift incisions if the mask is covering them. Your eyes are going to be kind of a mess regardless of what technique. They're going to be kind of blurry and kind of goopy. So having some saline, like these Refresh bullets that you can use to rinse out your eyes, is really helpful. You also can use a petroleum-based eye ointment that can go in your eyes and on that delicate skin really close to your eyes before you apply the Aquaphor. It's important that you don't let the exposed lasered skin dry out that is showing through the holes in the mask. So this is going to be around your eyes and around your mouth. What I like doing is taking 2 wet, icy cold gauzes out of your ice water bath, put a little Aquaphor on them and rub them together like you're kind of putting peanut butter on some bread, and then lay those Aquaphor side down against your eyes. You can then layer an icy cold washcloth or a spa mask that comes out of the freezer on top of that. Eating can be a little bit of a challenge while you have that mask on. One thing you can do is tuck like a little napkin around your lower lip on the inside of that outer mask. And that way, if you dribble, that will catch it and you can just remove it and throw it away. Also, larger diameter straws may be much easier than the normal small straws. Those are often referred to as boba straws that have a larger diameter. Think of foods that can be placed in your mouth, like cut up meats, cheese, and fruit, as well as nuts. You can use bread chunks, low sodium crackers, and nice big noodles like the shell noodles. Also, you can cut up popsicles or ice cream balls to help soothe your throat. If you need to use the open technique, say you get home and you have a freak out and you pull your mask off and you can't get it back on again, then what you need to do is use Aquaphor like a peanut butter and jelly sandwich. You're going to put this all over your face round the clock. That may be as often as 5 times a day or 10 times a day. Then you'll follow that with cold compresses. So you make a bowl of ice water, put a splash of vinegar in it, throw in a bunch of gauze pads and a couple of wet washcloths. You can lay those gauze pads against your skin and then follow with a wet washcloth. Those gauze pads are going to be soothing your skin and also pulling away some of the exudate or kind of gooey pus-like stuff that's going to come up on the surface of your skin. So you should shower as frequently as possible when you're doing the open technique. And while in the shower, you can clean your face with Cetaphil. You should shower as often as needed so that your skin doesn't dry out. It also helps to have a humidifier by your bedside. With the open technique, things tend to look worse before they get better. And you really do look your worst at about day 2 to 3 when a creamy white exudate is coming up on the skin. I like to describe this as the frosted donut stage, or maybe you fell asleep with your face in a bowl of oatmeal. This is going to be worse around the eyes and the mouth because this is where we go deeper. So be sure if you've taken your mask off or your facelift incisions are now open, that you're putting Aquaphor on them as well. The whole key is not to let anything dry out, and don't let layers of goo just accumulate on your skin. You do need to take a shower to clean this off. Healed skin looks like a dry, bad sunburn. It's no longer weeping or crusting. If it is, please add that Elta MD moisturizer or Aquaphor. On healed skin, it's okay to start your lipid serum or hydrating serum, that hyaluronic, to add some moisture. And this is when you get to use the wonderful Epionce Calming Cream. This feels great on the skin and can be used as often as needed. It's also a very important time to avoid any sun exposure. These next steps are easier because you'll already have a visit back in our office. You're hopefully back on your lipid serum already, and it's a wonderful time to explore some growth factors to help when your skin is remodeling. Our favorite skincare line is NeoCutis, which has some great products. Also, now that you're going to be going out and about, it's important to always be wearing sunscreen. Over the next 2 to 3 weeks, you'll be able to restart your Hydroquinone, and then a couple weeks later, slowly restart your Retin-A. Erythema is the medical term for redness, and it's going to take weeks to months for this to completely resolve. You'll notice it lasting longer around your eyes and around your mouth because the treatments were deeper here. We do have a great cover-up called All Calm, which is SPF 50 and covers up that redness like you wouldn't believe. All right, congratulations. You are super prepared for your upcoming surgery. Again, remember to bring questions with you to your pre-op appointment so we can address what you still don't quite understand. This is really big. If you're having someone help you after surgery, whether it's a spouse or a loved one or a friend, make sure they watch this video too, because they'll feel very responsible for you, yet they won't get much teaching about what you might need. Be sure you take enough time to heal like you need to and to get rest. And please, please, please follow your instructions.